Okay, so I know I look ghetto today, but today we're gonna talk about the structure of the heart. So, as we know, the heart is made out of four chambers. So you have your right atrium, your right ventricle, your left atrium, and your left ventricle. When you actually look at the heart, you will see that the left side is bigger than the right side. And that's all for a reason. The reason why the left side is bigger than the right side is because the left side of your heart is the pump that pumps all of the fresh blood out to the body. The right side of your heart, not so much. So you have the right side, it has a lot of deoxygenated blood. It's kind of like the receiver. It's taking in all of this blood. What does it do with it? It actually takes it and it pushes it out to the lungs. Because it's like, what do we do with this blood? It needs some oxygen. Whoosh, send it to the lungs. The lungs take it and the lungs put the oxygen into it. Now it's oxygenated and the lungs whoosh, send it back to the heart. When it gets into the left atrium, it goes into the left ventricle and then out to the body through the aorta. So the reason why that's important to know is because if you can imagine, the right side of your heart only has to reach the lungs, whereas the left side of your heart has to reach all the way down to your toes. So the left side of the heart is always going to be the biggest side of the heart. Um, Now, another important trick to know is once you learn the anatomy of the heart, let's see, we can go over right quick. I got my cheat sheet. Okay, so we have the superior vena cava and the inferior vena cava. Those are like some of your biggest major veins that are coming in. Everything's coming in. Oh man, we got to get to the heart. So they're coming in to the right atrium. They go from the right atrium into the right ventricle, and they go out the right ventricle into the pulmonary artery. Those two branch off because obviously you have two lungs, and then once they get to the lungs and they get in the capillaries and they get all oxygenated, then they come back through the pulmonary vein. And the reason why that's important is because your pulmonary arteries have deoxygenated blood and the pulmonary veins have oxygenated blood. That's like the opposite of what everybody's already told you, right? They told you your arteries always have oxygen, veins never do. But when you get to the heart, it's reversed. And the reason why that is because really, even though that's true, the veins usually have no oxygen, the arteries usually do. It's really more like the arteries always go to the heart and the veins are always going away from the heart. So then that's an easy way to help you remember that even these pulmonary artery and veins, even though they don't have the normal oxygen content, it's because that pulmonary artery is going back to the heart and the pulmonary vein is going away from the heart. I hope I didn't just confuse it. I'm trying to study for this big test, so this is the easiest way I think for me to remember it. Um, so let's see. You have, what else can I tell you about the heart? If I go into the valves right now, I'm going to confuse myself, so we're not going to go there. But you have your bicuspid and your tricuspid, and then you have other valves, which I don't remember. Obviously, that's an area that I need to refresh. What else can we talk about? So, really the whole reason why I'm doing this is because I really want to go over rhythms. The most important part of what I need to learn is how to look at the EKG and to be able to identify rhythms. So that's what we're going to try to do. Let's start off by explaining the electrical conduction in the heart. So at the top of the heart, you have your sinoatrial node. That's called the SA node. That's the first one at the top. It sits at your atrium. Then you have the next one down beneath that is your AV node. That one's also called your atrioventricular node. So generally, the sinoatrial node is the one that kind of starts the top of the heart from beating, like my head, if it's like your atrium, right? And then the electric circuit shoots down to your AV node, which is more like in the center of the heart, and that kind of starts the depolarization of the entire heart. But it's not just the AV node that depolarizes the rest of your heart or your ventricles. The SA node, the AV node, it goes through these right and left bundle of Purkinje fibers. So from the SA node, you're going to the right and left. It's going to split off into two, and then it's going to actually curve around like the booty of the heart. It's going to curve around your right ventricle, and it's going to curve around your left ventricle. Now what the SA node is going to do is it's going to travel around that circuit right there, and that circuit is going to go whoosh, like a booty squeeze. It's going to whoosh, and it's going to cause the ventricles to contract, and it's going to push the blood out to the body or to the lungs. The reason why those are very important to learn is because those are the areas, whenever there's a problem or whenever people try to describe a type of rhythm, they always kind of refer back to what part of the heart it is. So when they say sinus, it usually means above that AV, right? I said the sinoatrial is the AV. Yeah, it's above that AV node. So think of like the top bubble part of the heart. That's your atrium. Those are almost all of your sinus rhythms. I can't think of any rhythm that's sinus is going to come from the ventricles. Mommy. I like your purse. So, right, and so then when you get to most of your rhythms that are ventricular, obviously they're going to be coming from your ventricles, and those are going to be mostly the ones where the QRS is going to be wide. Maybe now I'm getting above myself, getting too far ahead. So when you have your EKG strip, it looks a little bit like this that I've drawn out. It's a very bad drawing for my notes. That's kind of like what your EKG strip is going to look like. That's a block, so that's not a really good EKG strip. But basically, when you have your EKG strip, when you look at it, you're going to see a line, and then the first bump is going to be your P. The P correlates to the atrium contracting. So the P, that first bump, is the top of your heart. The top goes first, and then the bottom. So the first bump is the P. Then after that, it's going to be kind of like it's going to be a big squiggle. That's going to be your QRS. The first up is the Q. The first down is your R. The last part is the S. Then after that, you'll see another kind of slower lump. That's going to be your T. So when you think of your heart rate, it's always going to be P, QRS, T. P, QRS, T. And that's the way every heart rate should look. P, QRS, T. P, QRS, T. And the rhythms, the erratic rhythms come in that aren't like that, P, QRS, T. Now, I know everybody knows the song, Now Walk It Out, Now Walk It Out, Now Walk It Out. That's one of my favorite songs. That's also one of the ways that you can determine whether or not, when you're looking at your EKG strip, if it's regular. If it's not regular, that's something that you need to be aware of. So you take your calipers, you put it on from your R to R, which is like the bottom part, that bottom part that sticks way down, or you can put it from your P to P, which is that little lump right in front of your QRS, and then you just kind of keep it at the same space as one P, and then you kind of flip it, and then flip it, and then flip it. And if they all match up, then your P to P walks out, or your EKG is rhythmic and regular.